Hello friends, today we will discuss about hiccup and we will discuss about what is hiccup and what are the causes of hiccup and then attached treatment. So this is about the clinical classes of hiccup. So hiccup is an involuntary spasmodic contraction of diaphragm and intercostal muscle. Okay, so hiccup is an involuntary spasmodic contraction of diaphragm and intercostal muscle. Then causes. The most common cause of hiccup is gastric distension, and this causes of gastric distensions are overeating, first of all overeating, then carbonated drink like Pepsi, Coca-Cola, then arophagia. Arophagia means swallowing of air, and causes are during smoking and chewing of gum. Then second cause is dyselectrolytemia, in example hyponatremia. Drug induced dexamethasone can causes hiccup. Then CNS causes lateral medullary syndrome, in lateral medullary syndrome post-op causes glottic stimulation due to intubation, and in ENT foreign body and ear pharyngitis and laryngitis can causes also a hiccup, and rare causes are malignancy and multiple sclerosis. So these are the causes of hiccup. Then treatment. So hiccup we can categorize hiccup in two types, and that is less than 48 hours persistent of hiccup, less than 48 hours and more than 48 hours. So in case of less than 40 hours, those are not serious concerning. So we can treat by physical maneuver. Hiccup we can treat physical maneuver, and those are first of all breath holding. In case of the causes of breath holding are results hypercapnia. In breath holding results hypercapnia, and those stops spasmodic contraction of diaphragm. We can perform Valsalva maneuver. Then gargling with very cold water. Due to gargling of very cold water, that can causes glottic stimulation, vagus nerve stimulation, and those results stop spasmodic contraction of diaphragm. Then biting into lemon, pulling on tongue, pressing gently and firmly on eye, and while sitting, pulling the knees up to the chest and hold the position for 1 minute. So those all are physical maneuver. And in cases of hiccup persistent more than 48 hours to 1 month, those are called persistent hiccup, and intractable hiccup more than 1 month, and those are very concerning and needs evaluation. And treatment are if patient on dexamethasone, then switch to methylprednisolone. Then the most common cause of hiccup are gastric distension. Then we can start a PPI like pantoprazole, rabiprazole. Then we can give muscle relaxant tablet baclofen 5 to 10 mg TDS. Those are all are adult dose. Then in cases of CVA, lateral medullary syndrome, we can give gabapentin 100 to 400 mg TDS. Then we can give metoclopramide. This is a prokinetic drug, 10 mg TDS. And if hiccup persists, then we can add tablet chlorpromazine 25 mg TDS. And other drugs are, we can use lidocaine, phenytoin, pregabalin, and carbamazepine. So this is about hiccup and causes of hiccup and treatment.